Hello, my name is Samantha Monto, and I am here for an oral presentation on an adult patient that I had seen in clinic with a pulmonary complaint. And to begin, this patient's ID, NH, she's a 61-year-old female, Caucasian, date of birth 11/1/64. Patient is unaccompanied and is a reliable historian. The patient's chief complaint is a cough. The HPI includes NH is a 61-year-old female who is here today for evaluation of a cough and shortness of breath. Symptoms started on 3/11/26 after returning from Costa Rica on 3/10/26. She reports symptoms including fever, body aches, chills, cough, chest tightness, and diarrhea. She denies nausea, vomiting, leg swelling, or appetite changes. She states that the cough is now productive, chest tightness with coughing, and pleuritic pain. She has taken Tessalon pearls, which have been helpful with coughing, but feels they are causing dehydration. The patient's past medical history includes anxiety, depression, endometriosis, hypoglycemia, and skin cancer. Upon the physical exam, vital signs were normal with heart rate 89, blood pressure 128/68, temperature of 97, O2 of 96% on room air. Respiratory rate was 14 per minute, and pain 0 out of 10. Physical exam on general, she is not in an acute distress. Appearance, she's well groomed, but she is ill appearing. Head is normal cephalic. The right ear, tympanic membrane, ear canal, and external ear are normal. There's no impacted cerumen, and that's the same as the left ear. For the nose, there is mucosal edema, congestion, and rhinorrhea present. The right turbinate and the left turbinate are both swollen. There's no maxillary sinus tenderness or frontal sinus tenderness in either the left or the right sinus. The mouth mucous membranes are moist, no oral lesions. Pharynx, there is posterior oropharyngeal erythema and post-nasal drip present. For the eyes, it's normal. Cardiovascular rate and rhythm are normal. Pulses are normal. Heart sounds are normal. No murmur heard. Pulmonary, there is accessory muscle usage present in effort. The breath sounds, the field reveals, right lower field reveals rales. For abdominal exam, the vowel sounds are increased and there is distension. There is abdominal tenderness and there is guarding. For neurological, the patient's mental status, she is alert, not confused. She's her affect is appropriate, her behavior is cooperative. So for the assessment and the differential diagnoses, I have chosen pneumonia, acute bronchitis, and COVID-19, with the primary diagnosis being pneumonia. For treatment for this patient, I have chosen azithromycin or Zithromax, 250 milligram tablet, taking 2 tablets or 500 milligrams by mouth 1 time per day for 1 day, and then 1 tablet, 250 milligrams, 1 time per day for 4 days, along with the amoxicillin clavulanate, potassium, or otherwise known as Augmentin, 125 milligram tablet. Take 1 tablet by mouth 2 times a day for 5 days. And that is referenced Lyo et al. 2025. I have also suggested for treatment adequate rest by slowly increasing physical activity as tolerated, and also getting adequate fluid intake to help thin mucus and prevent dehydration. And that was also referenced with Long et al. 2026. The assessment plan of care were discussed with the patient. All questions were answered. She is advised to discontinue the medication and notify clinic if side effects occur, and we will contact her with lab results. We have advised the patient to follow up in clinic in 5 to 7 days to ensure clinical improvement, as well as if symptoms worsen, the patient is advised to seek care immediately in the ER. And that is my case for this patient. Thank you.